affect your brain, and clearly multiple trauma will affect your brain. We have people with multiple symptoms as part of their brain health. Depression, anxiety, a number of other things. And so we see these as an interactive term. We are at the very early stages of understanding that interaction, very much like our friends in cancer were 2 decades ago.
Yeah, it's actually interesting you say that. In the 1990s, President Bush had a presidential proclamation and declared the 90s the decade of the brain. And he promised that by the end of 99, we would have all brain diseases figured out and cured. Fast forward 30 years and you're like, we're just, breaking into this field. So Natalie, I didn't plan this. This worked very well. I want to come to you next, though, because you actually, building on what Ross just said, you touch patients. And so bring this to an actual, human level for us.
Sure. So, like Dr. Ross said, thank you guys for being here. Thank you for putting a program like this together. In the context of patients, obviously it wasn't mentioned in the bio, but I'm also a nationally registered emergency medical technician. And so in that work, what we typically see, and honestly in the larger context of what we do as a country when it comes to mental health, we conflate mental health with mental illness all the time. And unfortunately, when it comes time to responding to, say, for instance, a behavioral emergency, we're mostly doing it in the context of responding to someone who's having some sort of psychological break or a couple of patients that I've seen, homicidal ideation or suicidal ideation. And so there's an extreme that is placed onto this entire conversation that I think, it's important to have, but in the context of what we're talking about today and patient care, it's important to bring that conversation back just a little bit in terms of what does mental health mean, what does mental well-being mean for every single one of us, and how we promote that specifically in youth sports, I think is particularly important because while you may have those resources in place to deal with when there's an emergency in patient care, we need to have a larger conversation about how are we going to implement mental well-being and mental health in a larger conversation for our athletes, young and in elite sports. So what does that mean, youth well-being from a mental health perspective?
And so I want to move into those complex things, and this is for all of you, but Julius, you're working deeply in this field, so I want you to sort of take this first. To explain those compounding, complex issues that are everyday adverse events and trauma and all those different day-to-day experiences.
Yeah, thank you. And I think what Natalie said is really important when you talk about well-being. In my career, you would kind of hear the common conception that, when athletes get done playing, they tend to struggle. And if we were aware of that, and as a player, you could identify other players that may potentially have these issues with having sustained quality of life, what are we doing to intervene? I got really concerned and really interested in figuring out why I wasn't as educated about what was happening above my shoulders as much as what I knew about going from the shoulders down. If I had experienced an injury, whether that was joint, bruise, I knew how to treat it. I knew some information about how to really take care of myself. And I thought, players, we need to have that from the neck up. And so I really wanted to dedicate, my future career to doing what I could to educate players and help them be more aware of what is mental health, what is brain health, and how are these things going to possibly impact all the players in our future. And when you talk about anxiety and depression and these things that are not well known and athletes don't always talk about, those are definitely things we can treat. This is what we've been studying in psychology for years, and there are some aspects of athlete health that we've yet to have a great way of treating, but anxiety and depression is something we can do for the players right now, and to really dedicate what we do professionally and medically to helping players as they are and what we know really well, and making sure we bring that to the players.
Yeah, and I'd like to come down to Chris and then to Morris to also talk about, building upon that, about we know more, about what's going on below the neck, and then, building up of resiliency and training, and how do we integrate these kinds of things into the lives of people?
Tom Coughlin has this saying, "Be where your feet are."
Speak up.
Is this good? And the idea is that we have so many ways to train our body as athletes, but we don't have that many ways to train our minds. Julius alluded to the challenges in transition. Absent brain injury, absent things of that nature, it's a pretty significant shift to go from a full-time athlete to basically a civilian. And I think you begin to prepare for that transition before it actually happens. And one of the tools that I've been passionate about and we've introduced at the University of Wisconsin is teaching their active athletes meditation, a way to develop those skills of resiliency. Ross alluded to sleep. There's some interesting studies about the benefits on sleep for folks who meditate. And then you've got those skills that help you as an athlete and then help you navigate the difficult transition. It's something I think that's really beneficial, and it's just starting to come. It's preliminary, but there's a lot of exciting research around meditation.
And then Morris, please frame for us, as we're talking about young people and all these external factors that are going on in their lives. So bring it right here to Miami and the world you live in, and the young people and what they're dealing with every day.
Well, I'm glad you brought that up as a pertinent question, because this process starts way beyond when a young person starts playing football. This process starts when they're in the cradle, when they're going to school, when they're interacting with their peers, as in the words that are being used, the interactions that they're having with others. And what we found is my responsibility is a huge one, and that's to deal with all of the children that find themselves on the wrong side of the law. And what we found out that over 50% of them suffer from mental health issues. And not even talking about the ones that play Pop Warner football and all of these other sports associated with what we're talking about today, but the overall environment, the socioeconomic factors that create barriers for these young people, and then create this stigma of mental health that they don't want to talk about those things. Those things are not important, and also those things show a sign of weakness. And so we have to find ways, in which we've done in this community, to connect with them on their level, to develop relationships with community-based organizations that they trust, because government is sometimes considered the big bad boogeyman. And what we want to do is make sure that we are availing ourselves to every opportunity to give them the services they need. And it's not us giving it, it's a collaborative, it's a partnership, because of the mere fact that the information that they're giving us back will help us as we move forward in our process of identifying mental health, substance abuse, and all of these other issues that carry on with these young people as they go into the sports world. And a lot of that work was done with national researchers many, many moons ago. And I have to point out my clinical director, Kathy Burgos, sitting in the crowd, who was leading that charge to make that happen. And I just want to leave you with this. If I don't get a chance to speak again, I want to give you some great news that due to the fact that we've acknowledged all of those stressors, all of those risk factors, and we put programs in place that directly affect that, we used to have 20,000 children arrested in our community, sleeping on the floor in detention centers back in 1999. Today, we only had 2,000 children arrested last year in our community. And so that speaks volumes to what we're talking about, the preventative work, catching it early, making those decisions that matter, and then we can start having those conversations going forward as to how we can get better at what we do.
Thank you. So as you were talking, we've got more people joining us, and I was noticing how many people were nodding their head along as you were talking. So what I heard from all of you, but it's that we're putting so many things in these silos, and we're not looking at the complex interaction. And I know there's not a magical answer, but how do we start changing the way we think about these things and we start acknowledging the mutual interaction?
So let me take a shot at starting with that great question, because it's the complexity of the day. How do we understand how so many things interact for brain health? How you were raised, as I said, what happened to you early on, what kinds of injuries, exposures you had, and that are you hypertension, are you exercising, how much salt do you take in, how satisfied are you in your life? And so there are lots of ways to begin to do that. One of the ways that we're doing that is looking at people who are really well with a similar exposure and those who are not so well, and trying to understand which factors within that group of people who are very much alike are causing the problems. But it's safe to say in real world practice, because I'm fortunate to treat players and former players, that so many of these things interact. To Julius's great point, there are things we can do something about now when people leave. How people transition out of the league. How people get help for things like depression, sleep apnea, anxiety. We can make a difference now for people while we're searching for the global answers to more complex problems.
But how do you get those, like you mentioned, Chris and sleep apnea, but how do you get past even those cultural barriers and those personal belief barriers to get these tools in the hands of particularly young people that you can influence?
Well, one thing I think that's inextricable from the conversation on health is the business of sport. And there's been a professionalization of youth sports. You see repetitive use injuries, kids playing year-round. That pipeline of talent goes on to play in high school, college, and ultimately the pros. So any earnest conversation around long-term health outcomes have to address the fact that we're turning tykes into pros. And there's a huge value add there to have a more holistic approach to the youth athlete experience.
Agreed. And to jump on to Chris's point, obviously professionalization of sports, but also early specialization and how that plays a role in things like overuse and injury for our young players. So there's a lot that could go into that particular conversation, but I agree. I would say some of the biggest ways to really change the conversation is through more of a holistic, and I guess you'd say an interdisciplinary approach. And granted, these approaches take people like Morris being at the table to be able to advocate for various cultural backgrounds, right? You cannot have any sort of program being implemented in any context without having those stakeholders at the table to be able to guide that particular intervention. And I think it starts with things like that, and then, like I said, having a holistic approach where we're focusing on risk assessment and screening, but then also having the resources available and accessible, not just available, but players know where to go for those resources, and they're not all the way across the athletic department somewhere that's not, accessible to them for when they're having those crisis moments, whether it's depression or anxiety, and it may be playing out very differently for some of your players. They may not present in the mental health construct. They may say, I'm having a headache. They may be presenting the physical symptoms because based on our cultural backgrounds, what is appropriate to say and how it's appropriate to address mental illness will play out in how we even seek help. So having those resources, and then from Dr. Ross's perspective, having those rehabilitative steps in place for patients who may have, or athletes who may have had crisis before, to be able to fully implement back into playing their sports is something that we need. So screening, having the resources, rehabilitation, and then also from a larger context, improving well-being as a general conversation.
Yeah, just to touch on it next, I think what's really important is to get different voices in the same room.
Of course.
I can think now to the same issues as a doctoral student, and I have a completely different perspective than I had as an athlete. And sometimes, in the medical field, we see the problems and we frame them all the same way, and that's what we're trained to do. But do we think about it from the player's perspective? Do we think about it from the coach's perspective and the organizations that are involved in this game? How do we get different views and different opinions on what are the actual issues? I mean, I think sometimes we fail to ask the players, what are your problems and how do we solve those? It's interesting that we frame, this is what we want to help and this is how we want to help you. But if we're actually going to help the players, and that's what we're waking up every day to try and improve his player health, we have to have them be a part of the conversation. And that's what's so important about, you know, Chris or myself or the people up here on this panel taking time to get those different perspectives. I've had so many conversations with Dr. Ross, and we talk about it. And what we both gain from those conversations is so important to be able to communicate what we can do for players across the board.
Well, I just have to say that we've been, in this community, really focused on that component and breaking down those barriers and those silos. But what it takes a lot of courage. It takes a lot of understanding that you're going to have to expose yourself and open yourself up and to some criticism. And the things that you may think are helping may be a hindrance. And you have to be willing to say, you know what, maybe I need to change this component of what I've been providing to this group because of the mere fact that it's doing more harm than helping. And we found that out over a period of time that we worked together with Together for Children. We had all of the stakeholders at the table. And as we talked about what we do and how we did it, some of us had to just say, you know what, I can't do that anymore because it's not working. It's not doing what we want it to do. So when we use data to drive everything, the data piece is integral and important because it allows us to really focus in on those things that we know work best. And for those things that don't, we get rid of them immediately. And so that kind of transparency, that kind of openness is tough to do when you're running an organization, but that's what it takes in order to get real results.
So that was absolutely amazing because I opened up the live stream to see if there were questions, and actually there are a couple questions like really tied to that. And so I have other questions of my own, but I actually want to get to this because it's so perfect. And it's people asking about this place we're in time where there's lots of conflicting data and competing information, and sometimes it hits the news and you read one thing and the next day you read the next thing and you don't know what's fake news and what's not. So, you know, as we're talking about building these coalitions and having all the stakeholders at the table, how do we make sure people are getting the right information and using the right data and thinking forward about the right kinds of things and not just the flashy stuff that pops up?
So I think you're spot on. That question is great. And the issue is multiple fold, right? Everybody wants their research in the media, but it gets clipped. No offense to the media, they're doing their job. It gets really soundbited, and so you lose a little of the messaging, and anything around sport is hyper highlighted. So we go from a suggestion of something or an association to a cause, to that's true, to oh my goodness. And so we have to be really careful about that. And I think that we all need to work together as a family to say we don't want to have what I refer to as a nocebo effect with people. And Julius knows exactly what I mean by that. It's a scientific term that means we induce the negative. Now, it's clear that there are negative things that happen, but we can induce too much of it by presumptive information. And what we find is that Chris is right, that early specialization isn't good, and that early major weight gain is also a long-term problem for people's health. People don't account for that. And so there are many factors that go along with this towards producing a well athlete, a well person, and what I refer to as years of brain health quality of life.
So, yes, as usual, Dr. Ross is right.
I'm going to bring her back to Boston for me.
But and I know we'll get to this a little bit later, but from the policy discussion, right? So this idea around data, being a scientist, we, various people up here are scientists in various contexts, but the idea of data and what that means, especially when it's being portrayed in a certain way, and you attach certain, like you said, causations and things to it. The issue, I think, is that we just don't have enough large longitudinal studies to really be able to parse out those tidbits of information that I think are the most useful, right? And so because of that, right now we have a very splintered division when it comes to research, because you have one group doing this and one group doing that, and then, depending on the context of who's within the study, that may yield a different answer. And so we get really caught up in this idea of, well, it's very confusing, but we have to understand, when you look at the demographics of that research study, they may not be the same at all. And so I think in the larger context of that, how we can really aim to work through that, it comes from a policy discussion. And I think that when you think of things like tobacco, so smoking, and how as a country we rallied around that cause, or maternal mortality, or issues with HIV/AIDS, and how when it became a public health concern, how we need to have mental health be a public health concern, we really put the resources behind it to have those larger sets of data, those longitudinal studies that can then yield, I think, better conclusions and better outcomes, not just in the context of sports, but in general. You know what I'm saying? Because you have to have those larger data sets to see.
And how do people then get involved and access such things? Because you're right. I mean, if you've got a study of 10 people who look alike, sound alike, have the same environment, the outcomes have not absolutely no application, but very little application to a completely different cohort. So how do you get people enrolled? How do you get people involved? Where do they even find that kind of information?
I'm just going to go for 2 seconds. It's super hard. You're completely right. The value of these big data sets over time and understanding what really happens to people like we're doing is crazy important. We look at the Framingham Heart Study, and it probably has hundreds of thousands of people. So all of those things are crazy important for us for the future.
Yeah, I think that one of the troubles we have is just a society at large is hearing the word weight. And as I've started to study more and more about the complexity of the brain, it makes it so hard to understand how all the relationships work together. And like Dr. Ross talked about the Nocebo Effect. If we rush to say, well, this is what could happen, then they might start to believe that will happen, and then they'll start to create those same symptoms. But if we say, it's going to take a bit, science is working on this problem, there are some things we can do in the meantime. Let's put our energy and our effort on the ways that we can intervene, that we understand really well, but we have to kind of hit the pause button as we let research do what it does. The problem is most people don't understand the research process and how painstakingly slow it is, and how so many studies all have to come together, and then it moves the science forward.
Yeah. And Chris, I'd like to come to you as someone who, in real time, as an athlete, made decisions about your future based on your knowledge, the information that was available to you, your personal experiences. So, how did you come to make the decision you did to walk away?
I don't know if I could probably take the whole 50 minutes and talk about it. One of the things we're kind of talking around right now is the difference in timeline between what happens in the lab and what happens on the field. And the reality is players aren't afforded 50 years to do an epidemiological study to make decisions that are in the best interest of their health. Of course, the research isn't definitive. We don't know what players are facing. Personally, I had 2 bad brain injuries when I was 14 and 16. Probably would have stopped playing contact sports if I was born 10 years later after that second bad concussion. I feel at times my decision's kind of been co-opted for some of these hyperbolic coverage around the game. That said, there's not a NBA players' health study trying to enroll all the former players, nor is there an MLB. It is somewhat of a unique problem within football. And Rather than dwell on kind of the negative aspect, I'm curious, Julius, I think we can all agree on instituting some interventions to prevent harm down the road. What are those?
He threw that at you.
Anyone out there?
Yeah,
So what the hell do we do?
You know, and I think that's a really important question. And that's what takes the collaboration between researchers, players, and advocates. Because if we look at the three main problems we're facing, what's the best treatments available? How do we get people to seek treatment? And how do we get them to adhere to treatment? And if you leave a certain voice absent from the table, we could come up with the best possible treatment. But if we can't get the players to seek the treatment or adhere to it, it's null and void. And that's why I continue to say that we have to pause a little bit so we can think about what works for all parties involved. If we decide as researchers, this is the best way to keep people safe. For example, there was a conference I was at, and one of the researchers said the best thing to do post-concussion is to put a player on a ketogenic diet for 48 hours, no food. Well, that made sense to somebody that was a researcher, but if you've ever met a defensive lineman that consumes thousands and thousands of calories a day, would they adhere to that? So oftentimes, if we only look at it from one perspective, we're gonna miss on what will the players actually do. So I think the player's voice is so key, and we have to find ways to keep bringing in the players and the organizations into the conversations.
And Chris, I appreciate you bringing it, back and saying, here's part of the conversation we're not having. Before I build on that, did you have something you wanted to add, Ross?
Basically, what I was going to say is these two gentlemen are completely right. One of the things we need in all of this sphere is participatory action research, which is a fancy way of saying players' input. We need their input of what's valuable, what's important, what represents long-term quality of life. That's where the targets should go. And then that transition point, when you leave professional sport or when you leave college sport, that transition into, I'm no longer doing that, I think that's a critical time. We need to understand that more.
Well, and that's why we're so lucky to have, these guys up here. They not only understand the sport, but they understand the science and the back end, and it's incredible that you guys are here. So that real world application, I'm gonna come back down to you, Morris, but I wanna hear from everyone. And then we're gonna have a few minutes for audience questions. But Natalie, you mentioned politics. And I would be disingenuous if I didn't actually, talk about the real world we live in. And so as we talk about these access problems, these enrollment problems, these, cultural conflicts, and we look often to government funding. We look to partnerships, public-private partnerships. How can we improve? Where does funding need to be going? What does the government, whether state level or federal, need to be doing? What do the universities need to be doing? I mean, there are real politics involved in what gets funded, who pays attention to what. How do we make the incentives better?
I think that what Chris brought up earlier, and I was waiting for someone to say it, is that he had concussions at the age of 14 and 15. That's important. I played high school football and college football and had several concussions. And I understand the effects of it. But I have to say that we recently had an incident here where a young man walked out in front of a train and committed suicide. I think he was 15 years old, and he had a full ride scholarship to Georgia Tech and had mental health problems, but no one recognized him because that population is not looked at as important as the guys that played the game at the very highest level. So
yeah, so build on that, but then so back to politics.
Right.
Look at the NCAA,
Exactly.
Who's accountable at what point?
Exactly. And so what came out of that was that the school system now here in Miami-Dade County has put together a task force. They've made the decision, led by Dr. Bendos Mendengal, to now put together a task force to educate athletic directors, educate coaches, educate players at the very youngest ages as to look for those types of things. And once we we codify that and put that into our laws, into our policies, into our procedures, then we can rest assured that we will be a little bit better. It's not going to solve all the problems, but I think that once we start recognizing that this is not just a problem on the very highest levels, but it starts out at a very young age, those are the types of things that we can codify and put into law and put into practice within our schools and with our communities.
And I agree. And to Morris's point as well as Julius's point, it's this idea of integration, right? It's this idea of integration. And so, we have the larger context or conversation around policy and how difficult that is. But I agree, you start where you are. Just like you said, you start with what you have and with what you know. And, in the context of youth sports or even elite sports, these athletes are being treated on they're being seen, they're being assessed for their physical health, as you mentioned before, treated from the neck down on a regular basis. So their primary care physician, whoever they're going to for these individual and initial assessments, should also have that language and the resources within their capabilities to also assess for mental health. So it shouldn't be a separate conversation, and it shouldn't be a conversation that's only brought up when there's a crisis. It's how do we regularly implement these things into the primary care setting, into allowing for them to have that assessment from a physical perspective as well as a mental health perspective at the same time. So it's not a separate conversation.
If I could add to that, I think we're all in agreement of the importance of translational research involving patient as healthcare consumer. I think the structural context precedes earnest conversations around athletes voicing their concerns. Nicole, you mentioned the NCAA. As a college athlete, you literally cannot afford to speak up. An empire is built on your back, and the next guy's chomping at the bit. And you'll be out the door if you get on the wrong side of the coaches, or if you complain, or if you're Kane Coulter and you try to unionize, and then your career's over. So I think we need to address the container, and then we can have honest conversations about health.
Thank you. And I agree. Wasn't there the NCAA, didn't they have a consensus report that kind of looked at the different challenges that youth athletes are experiencing, and then mental health was at the top of that list.
You're
So
right.
the youth athletes are speaking. It's just a matter of who's going to respond to that concern.
And part of the instigation for the topic and theme this year in Miami was actually a late summer International Olympic Committee report that was focused specifically on this. And for me, it was validation as we were choosing the theme of saying, all right, yeah, I mean, the IOC is having to take a step back and say, this is our number one priority for young athletes, which I think speaks volumes. So there's only a few minutes left. We can hear all of our friends joining us. So to wrap up, I'm going to allow a couple questions. I don't think there are microphones floating. All I ask is that you please make them questions, not long statements, and no product pitching. We've learned from years past. So we'll start with Dr. Lippy Roy.
Thank you so much. My name is Lippy Roy. I'm an internal medicine and addiction medicine doctor in New York. And so brain biology is fascinating to me. We know that the brain is the most complex machine known to humankind, and yet we understand maybe at best 10% of it. Harm reduction, I think, is something really important. And Julius, you talked about, talking to players and understanding what they're going through and empowering them. That's what we're trying to do in the addiction world and mental illness world. What do you need specifically? And so but the main question I had was, stigma still remains the barrier to care. According to the World Health Organization, drug addiction, mental illness are the world's most stigmatized social problems. So I wonder, from the NFL standpoint, pro athlete standpoint, in university levels, what do you think we need to really do to reduce the stigma so we can thank you to Mr. Steinberg for having events like this so we can have this conversation. Whoever wants to take that.
Thank you very much for that question. And it's true. It all comes to stigma. It comes to access. How do we make this information that doctors and researchers have, and how do we make it applicable to the people that we want to help? And I think one of the things that Morris and I talked about earlier was it's the language. What we know about the brain and what we know about internal medicine and the nervous system, it's written at a doctoral level. It takes years and years of relentless study just to kind of understand some of the interactions. If we want mental health to be something that people can access, think about, and do something about, we have to put it in their language. And I think that sometimes as in the medical field, we're resistant to changing the way we talk about some of these parts of the brain or psychological disorders. People are going to be turned off if I come in and I use the same presentation that I use with my fellow students and peers. I have to find a way to translate that information into their language, and we have to get outside of campus. We have to get out into the communities and make ourselves a little uncomfortable and have that courage that Morris talked about so that we can give them access that they understand. So I think that one of the most important parts is making sure we translate this information so where somebody with a high school degree or less, especially if we're talking about young children, can understand it.
Hi, so thanks so much. You guys are incredible. Julius talked about the importance of understanding ourselves better from the neck up. And I'm wondering, at every level, from what Morris described with that tragic situation with a 15-year-old to current professional athletes to those that are transitioning into retirement, what do you see as the best resource to help us better understand ourselves from the neck up for anyone?
Well, I can say in my experience, meditation has been really helpful. In 2017, we ran a pilot study at the University of Wisconsin at the Center for Healthy Minds. There's a researcher there named Richie Davidson, was one of the early neuroscientists to prove that meditation changes your brain physiologically. I think it's great in and of itself. It helps with awareness. It helps literally to understand what's going on upstairs. I also think it's a great side door into men, and particularly young men, having conversations about their mental health. So when we ran this study, we'd sit and we'd meditate, and it was great. Afterwards, the conversations were really much more open. Guys were comfortable being vulnerable. And I think that connection is invaluable.
Yeah, I think the most important resource is the teams, because we're talking about transition and we're talking about players. You have to meet them where they are. So if you're on a college campus or a high school campus, that means the coaches have to understand mental health. That means the coaches have to impress upon the players. That means the parents have to impress upon the players. This is going to take a everyone job to help make people more aware of how to sustain quality of life. And I think it has to happen not after you leave the league or after you left college and you're starting to get these symptoms and you're struggling. We have to start talking about it on the way in. And I think that that's kind of a barrier that we have to knock down as of right now.
So I agree with everything that's been said. I would just add that peer support all the way through the process. We've found this in our work in the military as well. Having someone who is like me, there is nothing like that in cultural associations. So that's number one. Number two is we teach people about joint health and heart health. We do a terrible job about teaching them about behavioral health. If you're anxious all the time, that affects your entire system and your overall quality of life. And so getting an appreciation that my wellness is my wellness is spot on, really a need.
Absolutely. They said everything. I would just say mental health is everyone's business, right? It's everyone's business. And yeah, no, you're right.
Hi, my name is Paulo Delaquila. I'm the founder of Concussion, Pain, and Mental Health Awareness. About 4 years ago, I was diagnosed with post-TBI. After a doctor's history, I've received close to about 35 concussions. So it started taking a negative and turning it into a positive, where with our grassroots not-for-profit, we're trying to bring awareness like we're doing here tonight And a common question is, I reach out to a lot of underserved communities and a lot of the middle class communities, and the parents come to me and they said, I don't have the right insurance. I can't find the right doctor. I couldn't get an appointment probably with any half the panel that's sitting at the stage. You know, there's only so many numbers. Do you have any recommendations that people could look up online? You know, guys say, well, go to YouTube. I'm learning as I'm going. We've only been operational for about a year. We just started a TV series trying to bring more awareness that I would love to talk to more or each of you about. And but basically, I just would like to know if you had any suggestions for parents out there that they could find more resources on mental health and this subject.
Well, first, I would say, I'm going to send this down there, but it's also a great time to mention, you guys talk about the podcast and the documentary series you're going to be starting. I mean, they're going to be investigating these things, and they'll come with, solutions and, or not solution, but like a solution-oriented approach to thinking through, what people need to know. So, please.
We're missing.
Nicole, wait, we have one more question if it's okay.
Sorry, I don't know if can anyone hear the question?
Yeah, I think that what resources could parents from middle and lower class communities access to find out some of the answers for their questions? And I think that that's what we're missing. We talked about it today with some of the competing findings, and that's kind of the process of science, but it's hard for people outside of science to understand that. But we do have to do a better job of providing resources and concentrating information about what we do know, and not adding information that's more speculative in nature. So I think that falls on us, and that falls on the people that work in the field of traumatic brain injury, mental health, holistic health. We have to do a better job of providing the resources that they can access. And I think that really starts from getting out of our silos and getting out into the communities and doing some of that work that is maybe not as glamorous as publishing the best study of the year.
And I also want to highlight that actual question in a different way has been posed the last 3 years in a row. So every year when we get together, people are asking for more resources. And so, I think that just shows how great the need is. And this is coming from a very well-informed group of people. So with that, I would like to say thank you to Lee for giving us this opportunity. Thank you to the panelists. If you want to revisit any of this, we'll keep the live stream up. You can come back and see all the questions. There was a lot of discussion happening online. And I thank you all. Go forth, have a drink, have some food, meet people, and certainly meet each other, because everyone in this little family here, as Ross called it, you're all here for a specific reason, and you all bring something very unique to the table. And really, it's everyone here sitting at the same table that's going to make a difference. So thank you.